Dean Ari, you may begin.
Okay. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Honorable Professor Kadir, Director General of Health Service, Minister of Health, Republic of Indonesia. Honorable Professor Aris Junaidi, Director of Learning and Student Affairs, Minister of Culture and Education, Republic of Indonesia. Professor Ari Kunchoro, Rector of Universitas Indonesia. Dr. Stephen Cantor, President and CEO, Association of Academic Health Center International, Professor John E. Lee Wong, Senior Vice President, and Senior Vice President, Health Innovation and Translation, National University of Singapore, and Senior Advisor, National University Health System. Professor Edward Hillhouse, Emeritus Professor of Medicine and former Dean of University of Leeds, UK, a consultant, Association of Academic Health Center International, and also Vice Dean, Faculty of Medicine of Indonesia, Professor Dwiana Okvianti. All the coordinators of the Academic Health System Pilot Project in Indonesia, distinguished guests, ladies and gentlemen. Good morning. As a Dean of Faculty of Medicine, Universitas Indonesia, and Regional Ambassador of the Associations of Academic Health Center International Southeast Asia Regional Office, I would like to express my warmest welcome to all of you to Academic Health System Concept webinar. It is such a wonderful opportunity for us to gather today at this virtual meeting. I'm so pleased to see such a diverse representations of participants from many institutions. It shows the importance of our webinar at this time. It is also such honor for us to have Professor Aris Junaidi from Minister of Culture, Education, Republic of Indonesia, and also Professor Kadir from Minister of Health, Republic of Indonesia, to give remarks for this webinar. We know that the academic health system is a concept of integrating education and research in symphony of health service delivery. Its goal is to achieve seamless functional integration among its members for better service to the community. I believe the academic health system, as an important part of the global and local health system, has a significant role to enhance health and well-being worldwide, especially during this COVID-19 pandemic. Our guest speakers, Professor John Wong and Professor Edward Hillhouse, will share lessons learned, best practices, and comprehensive understanding of academic health system. This is without a doubt beneficial for us. We will also have the unique opportunity to hear from the Academic Health System Pilot Project in Indonesia to share their experiences and challenges on how to implement the academic health system nationally. Last but not least, I would like to express my gratitude to Dr. Stephen Cantor and the AAHCI staff for always supporting our faculty and members of the AAHCI Southeast Asia region, and all speakers for the extraordinary effort in making this webinar possible. I hope that this event will be rewarding, that every institution involved here can benefit from today's discussions. On the next programs together, we will watch the remark from the Rector of University Indonesia, who unfortunately could not join us live in this webinar. Thank you for your attention.
Apologies for that. Was the sound working?
No,
The
not
sound
yet.
is not working.
Okay. Okay. 1 second. Apologies, everyone. Just a second. Okay.
Assalamualaikum
Is it working now?
Good morning, Honorable Professor
Yes.
Dr.
Yes, okay.
Sam, Dean of Faculty of Medicine UI and Coordinator of AAHCI, Honorable Dr. Stephen Cantor, President and CEO Association of Academic Health Center of International, Professor John Uli Wong, Senior Vice President, National University of Singapore, Professor Edward Hillhouse, Emeritus Professor of Medicine and former Dean of University of Leeds, UK AEF Consultant of the System of Academic Health Center International, Director General of Health Service, Ministry of Health, Republic of Indonesia, Director General of Higher Education, Ministry of Culture and Education, Republic of Indonesia, all the coordinator of Academic Health System Pilot Project Indonesia, all distinguished guests. Ladies and gentlemen, I feel honored that I'm given the opportunity to open the Association of Academic Health Center International Southeast Asia webinar, the Academic Health System Concept in early 2021. On the behalf of Dr. Indonesia, I would like to deliver a warmest welcome to all webinar participants this morning. Dr. Indonesia, as one of the leading universities in Indonesia, was assigned to implement the academic health system for the Jakarta region in 2014. AHS is a strategic collaboration between Dr. Indonesia Teaching Hospital and other health stakeholders in DKI Jakarta to improve the health service, education, and research. Through the Faculty of Medicine, University Indonesia Involvement in Association of Academic Health Center International is expected to support the implementation of academic health system with global knowledge, which lead to multidisciplinary research and clinical practice improvement. According to the Ministry of Degree of Medicine Research, Technology and Higher Education, number 55 in 2018, there are 5 universities that were deployed at AFS National Pilot Project with consists of Indonesia, Gajah Mada, Sejarah, and Teknologi. This university implement academic health system according to the region. This pilot project is an excellent beginning for other universities to improve their local health system. As the academic health system has great potential to improve our national health system, this webinar is written to strengthen the understanding in academic health system concept and implementation for those who are involved in academic health system. It provides knowledge of the academic health system concept, academic health center best practice from Singapore, and how to confront challenges of establishing an academic health system. I hope this webinar will bring us a better understanding of how to optimize the implementation of the academic health system in a fast-changing environment. Through this webinar, we also share some experiences in academic health system implementation in AHS pilot project and discover the best practice that we can elaborate together. Last but not least, I would like to thank the Dean Bahari as the Dean of Faculty of Medicine UI and as the Regional Ambassador of Association of Academic Health Center International for the extraordinary effort he has made in making this regional webinar possible. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Professor Dr. Abdul Qadir, welcome. You are welcome to give your remarks. And you're muted currently. There you go.
Okay, good
Please,
morning
go ahead.
for all of you. Thank you. It is time for me now?
Yes, go ahead.
Okay, thank you. Assalamualaikum warahmatullahi wabarakatuh. Good morning, the Honorable Dr. Stephen Cantor, President and CEO of Association Academic Health Center International, Professor Ari Kunchoro, Rector of University of Indonesia, Professor Ari Fahril Sham, Dean of Faculty of Medicine, University of Indonesia, all of the international and Indonesian speakers. Also is Dr. Aris Junaidi, Professor Aris Junaidi from Ministry of Education and Culture of the Republic of Indonesia. Ladies and gentlemen, first of all, allow me to introduce myself. My name is Professor Dr. Abdul Qadir. Currently, I serve as a Director General of Health Services of the Ministry of Health of the Republic of Indonesia. I am very pleased to meet everyone today virtually at the Association of Academic Health Center International in webinar of the academic health system concept. I would like to take the opportunity to extend my deepest gratitude and appreciation for the support from the Faculty Medicine of University of Indonesia as the Association of Academic Health Center International Southeast Asia Regional Office for hosting the webinar and inviting me to the important forum. I warmly welcome all participants in this event. My appreciation to all of you, especially Indonesian and Southeast Asian colleagues who joined the virtual participation in the webinar. Ladies and gentlemen, I am on the view the higher education has an important in health development where education must meet the needs of the health system. So there should be a harmonization between education and health services. The first thing to pay attention to is the synchronization of supply and demand between higher education and health services. The Ministry of Health as a user has a role in all stages starting from the formulation of services standard, competency standard, and others. The second is a synchronization regarding education and service arrangement based on the law number 29 of 2004 concerning medical practice and in the education system must be guided by law number 20 1917 concerning medical education in which synchronization involved the role of professional organization. And the last one is quality assurance, where at the education level is carried out through the exit exam, while at the service level it can be done through credentialing, so that there is a need for harmonization between educational output standard and work competency standard. I think this is important thing for all of us. Ladies and gentlemen, academic health system is a new model of integrated health services that is committed to improve the quality of public health services through education for health workers, quality health services, and excellent research. The implementation of the academic health system is expected to be an ideal form in effort to build a tight and sustainable service system. With the integration of academic health system between unique community, teaching hospital, and practice plan, it is hoped that it can be improved the community health status in the area that has been determined by all its members at continuous and sustainable manner. Ladies and gentlemen, accordingly, academic health system has benefit for various parties involved. For the Ministry of Education and Culture, it can become a center of excellence in science and technology, in addition to improve the quality of education and the reputation of higher education. For the Ministry of Health, academic health system can develop an effective and professional health services model and produce competent professional health personnel. And also for the Ministry of Finance, academic health system is an economic asset that's run efficiently. For the health office, academic health system can improve the quality of health services, the referral system, and the urban health system model. For the national health insurance, like a BPJS in Indonesia, as you know, we have a BPJS. Academic health system can encourage health services that pay attention to quality and cost control. In the end, for the community, academic health system can increase community satisfaction and loyalty to quality health services and benefit from research result and innovation in the health sector. Ladies and gentlemen, we gather here today to obtain the overview on this concept of academic health system, academic health center and system. And this webinar is also aimed to discuss strengthening collaboration within the center and system, with a special lens on the case of Indonesian. Finally, ladies and gentlemen, without further ado, it is my best hope that we will have a productive and fruitful webinar today. Hopefully, the webinar today would deliver most favorable outcomes to strengthen the comprehensive and integrated academic health system by privatizing the quality of services, education and services, and research so that they can support the achievement of the National Health Priority Program. Thank you. May all of us always blessed with health and happiness. Stay safe and keep healthy. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Thank you, Professor Dr. Abdul Qadir. Professor Dr. Aris Junaidi, please go ahead.
Thank you so much. The Honorable Director General of Healthcare Service, Ministry of Health, Professor Abdul Qadir, Director of the University of Indonesia, Prof. Ari Kunchoro, the Honorable Dean of the Medical Faculty, University of Indonesia, as a Regional Ambassador, Association of Academic Health Center International, Southeast Asia, Professor Dr. Arifah Riasa, and also the Honorable President and CEO, the Association of Academic Health Center International, Dr. Steve Kendall, the National Working Group of Academic Health System Indonesia, Joint Committee of the Ministry of Education and Culture and the Ministry of Health, and the honorable expert and speaker, and the honorable guests, ladies and gentlemen. A very good morning to all of you. Assalamualaikum warahmatullahi wabarakatuh. I'm here to speak on behalf of the Ministry of Education and Culture and would like to apologize that the Director General of Higher Education is unable to attend this webinar due to another commitment and due to another urgent matter. Therefore, I, the Director of Learning and Student Affairs, here today to be his representative to convey policy direction of the Ministry on this webinar. Distinguished ladies and gentlemen, continuing academic health system development since 2017 by Joint Committee of the Ministry of Research, Technology and Higher Education and Ministry of Health, the new Joint Committee now is between the Ministry of Education and Culture and the Ministry of Health. Also set priority setting for further academic health system development start in 2020. Joint Committee had appointed National Working Group to monitor and evaluate academic health system development according to the roadmap, as well as also did benchmarking and networking with other countries and global network, particularly through the Association of Academic Health Centers International. This mission of academic health center system development in Indonesia is to achieve better health outcome with cost effectiveness through continuous quality improvement of the integrated education, research, and healthcare services. The academic health system development should confirm global and national challenges, Industrial Revolution 4.0, and as well as Society 5.0, including the pandemic COVID-19. And now we're focusing on quality and values-based care. Academic health systems are, at least in principle, well placed to foster innovation in healthcare. The pandemic COVID-19 had proven academic health system contributions through some collaborative programs, translational research, and innovation that contributed directly to society in each region. Partnership with the local government and stakeholders as one of key success are also strengthened during pandemic COVID-19. In line with global movement toward universal health coverage and national health policy, which is anchored on strong primary care. Academic health system Indonesia is also directed to enhance primary healthcare and to overcome maldistribution of healthcare providers. Distinguished ladies and gentlemen, academic health system Indonesia is already implemented milestone development, which include 5 components recommended by AAHCI: mission alignment, international accountability, external accountability, interprofessional education and practice, and knowledge generation and dissemination. According to the evaluation of 5 academic health system pilots, UA or University of Indonesia, Pajajaran University, Gajah Mada University, Airlangga University, Hasanuddin University until 2020. And Joint Committee will focus to strengthen academic health center or collaboration of medical faculty and teachings, hospitals, are core of academic health system. On the other hand, Joint Committee had formulated minimal standard or parameter for academic health system model, and academic health system share mission that align with local needs. In national level, Joint Committee is now formulating presidential decree to strengthen the regulation of academic health system. Implementation that assists of cross-ministerial policies, particularly regarding human resource and financial management. Joint Committee also endorsed 5 academic health system pilots to become academic health center international member or partner in order to have global network of academic health leaders, advocacy support, and opportunities for networking and professional development. We also need assistance and support for AAHCI to achieve academic health system mission through more effective strategy. Distinguished ladies and gentlemen, we would like to convey our sincere gratitude to all speakers today, AAHCI team and medical faculty of Indonesia University, as Southeast Asia region office for conducting this fruitful webinar. I wish you all enjoy the webinar to share experience and lesson learned to formulate follow-up action of academic health system development in Indonesia. Hope that we are not only talking about the concept, but how to implement academic health system in various models to achieve shared mission, better health for all, and rapidly changing environment. By saying Basmalah, Bismillahirrahmanirrahim, I hereby declare the webinar officially open. So thank you so much, and thank you very much.
Thank you, Professor Dr. Aris Junaidi. Last but not least, in our opening remarks, Dr. Stephen Cantor, our President and CEO of the Association of Academic Health Centers, will begin today's session. Dr. Cantor, the floor is yours.
Thank you very much. Greetings to everyone. I'm delighted to have a few minutes to spend with you to talk about the importance of academic health centers and systems and how joining together in an academic health system can lead to new and valuable advances in healthcare. It's wonderful to be here with Dean Ari Siam and distinguished guests from the Ministries of Health and Education and other distinguished guests. I want to take a moment to recognize the University of Indonesia for its leadership in the region and very high level of engagement to keep everyone informed during the pandemic. We appreciate your collaboration with our offices in Washington, D.C., and of course, your leadership in planning this meeting. And I want to extend a very special note of appreciation for the leadership and outstanding work of AAHCI Regional Ambassador Dr. Ari Siam and Dr. Iman Budi, and of course a special thank you to Regional Office Manager Ms. Indah Susanti. I'd like to spend a few minutes talking about why universities and hospitals join together to form academic health centers and systems. And academic health centers and systems are defined a little bit differently in different areas around the world. But in general, an academic health center is composed of a school of medicine, often described as the anchor of an academic health center, a main teaching hospital, sometimes more than one, usually located on the same campus or nearby, and other health profession schools like nursing, dentistry, pharmacy, and so on. The nature of the relationships among these entities varies. Sometimes the university owns the medical school and hospitals, sometimes neither owns the other, but there is a well-written affiliation agreement that defines how the entities will work together and grow together. And sometimes there are a variety of other arrangements. As an academic health center grows and forms strong relationships with hospitals that are not part of the main center, and forms relationships with community health systems and other entities, it often begins to call itself an academic health system. And in some countries, the phrase academic health network is being used. For example, in England, the National Health Service has identified 8 academic health networks. The important point, of course, is that regardless of how the relationship is structured, and regardless of who owns whom, hospitals and medical schools want to build strong relationships, because it's these strong relationships, if structured properly, that lead to better doctors, better scientists, better patient outcomes, and even to the development of new drugs and devices, new companies, and economic growth for a region. That's why the United Kingdom is investing in developing its 8 academic health science centers. That's why you see growth and development of academic health systems in other places in the world. I want to just finish up by citing 10 reasons why it's valuable to develop academic health systems. And hopefully this will stimulate good conversation. Number 1, they stimulate economic growth. Number 2, they attract new talent to the region. Number 3, they help move discoveries to the marketplace. Number 4, they create new jobs locally. Number 5, they reinforce the complementary roles of research and teaching. In other words, 1 + 1 can be more than 2. Research and teaching can improve each other. Number 6, they catalyze intellectual cross-fertilization, which leads to innovation, which of course leads to economic growth. Number 7, they support the kind of risk-taking that leads to new ideas. That's much better done when institutions come together into a larger entity. Number 8, they cultivate individual potential. Number 9, they can develop trusted health tourism destinations. And number 10, they establish a culture of excellence at the nexus of health, education, and science. And of course, we at the association at AAHCI are ready to partner with you, as we have been, on an amazing journey to build academic health systems and help them grow and develop. And with that, I wish everyone to stay safe and stay healthy, and I'll turn it back over to the moderator. Thank you.
Thank you, Dr. Cantor. We will now have our moderator begin the session with our guest speakers and presenters for this webinar. Professor Ovi, you may begin. The floor is yours.
Thank you very much, Dian Ari, Rector Ari Kunchoro, Prof. Kadir, Professor Aris Junaidi, and Dr. Stephen Cantor for your wonderful opening remarks. Good morning from Indonesia, and welcome to the Association of Academic Health Center International Southeast Asia LIVE webinar on the academic health system concept. I'm very delighted to be here today. My name is Duyana Okvianti, and I will chair this session. Please allow me to remind you that our guest speakers will be given 7 to 10 minutes to speak, followed by a panel session where representatives from each academic health system pilot project in Indonesia will give 3 minutes presentations. We will then have a Q&A session for our guest speakers and pilot project panelists. You can type your questions in the Q&A feature at the bottom of the Zoom toolbar on your screen, and we will deliver your question to the panelists. Please indicate who your question is for. I would like to introduce the first speaker, Professor John Early Wong. Professor John Early Wong, Isabel Chan Professor in Medical Sciences, is Senior Vice President, Health, Innovation and Translation, National University of Singapore, and Senior Advisor, National University Health System. He is a medical oncologist, hematologist by specialty, and a member of the USA National Academy of Medicine, co-chairing their commission on creating a global map for healthy longevity. He will deliver the presentation on the role of an AAHCI in the academic health system, best practices from National University Health System in Singapore. Professor John Wong, welcome, and the time is yours.
Thank you very much, Professor Diwana. Professor Dr. Aris Junaidi, on behalf of Professor Nizam, Director General of Higher Education at the Ministry of Education and Culture, Republic of Indonesia, Professor Dr. Abdul Qadir, Director General of Health Service at the Ministry of Health, Republic of Indonesia, Rector Ari Kunchoro of Universitas Indonesia, Dean Ari Faryal Syam, Dean of the Faculty of Medicine at the University of Indonesia, Dr. Stephen Cantor, President and CEO of the Association of Academic Health Centers and Association of Academic Health Centers International, the leadership of the Indonesian medical system. Thank you very much for having me speak at this morning's webinar. Let me share my slides here. Can this be seen?
Not yet, Professor Wong.
Okay, let me get into. Great. Are you able to see that now?
Yes.
Yes, great.
Excellent. So perhaps I can start off by asking the question, what is the role of an academic medical center and that of an academic health system? I would say that because of the Academic Medical Centers Association, well, as Dr. Cantor mentioned, that the medical school is the actual foundation of the
Oh, Professor Wong, sorry, you muted. There you go.
Right, okay.
And
because the medical...
Sorry, could you play the slideshow and we'll just start back up?
Okay, sorry.
That's fine. If you can play slideshow.
Since you are screen sharing, let me just go back.
So at the bottom right, the play slideshow, if you can click on that, we should be good. There you go.
Great. Thank you
All set.
again. So as Dr. Cantor mentioned, given that the medical school very often, actually is one of the foundations of an academic medical center, I would say that academic medical centers set standards. And they set standards by defining and measuring excellence. So the definition of excellence is important, and then actually measuring how far we are off that standard that we set. And this defining and measuring excellence is across 3 domains. It's in promoting health and providing accessible, affordable, quality healthcare. It's in training current and future staff. And very importantly, it's in developing sustainable solutions to the country's health and healthcare challenges. So that, to me, is what an academic medical center strives to do. An academic health system then goes further. It ensures that this excellence impacts a whole population. And it does this by integrating both health and healthcare from prevention to end of life. It trains current and future staff, not only for hospitals, but for the community. And then it develops and implements sustainable solutions to the country's health and healthcare challenges at scale. So just to share what's been happening in Singapore. So the National University Health System started off as the first academic medical center in Singapore, comprising the NUS Yong Loo Lin School of Medicine, the NUS Alice Lee Center for Nursing Studies, the NUS Faculty of Dentistry, and soon after that, the School of Public Health was formed from the Department of Epidemiology and Public Health in the School of Medicine. It became a separate school as the Saw Swee Hock School of Public Health. And that was together with the National University Hospital and 3 national centers, cancer, heart, and oral health, came under one common governance in 2008. In 2017, we went to become a full-fledged academic health system by incorporating 2 large hospitals in the western part of Singapore, the Ng Teng Fong General Hospital and the Jurong Community Hospital, Alexandra Hospital. And then all the primary care, all the public primary care institutions in the western part of Singapore under the umbrella of the National University Polyclinics. And so now the National University Health System is charged with looking after population health for the western part of Singapore, and we provide education and healthcare for the whole of Singapore. So how do we define and measure excellence? We are a great fan of the work piloted by Michael Porter and colleagues at Harvard, where we want to define actually three domains. Firstly, we want to define what is excellence, what is quality, and this is defined by both the people seeing the patients. We have 53 conditions where the teams actually define what is perfect care. And then we actually measure the actual cost required to deliver that care. And that to us defines what value is. I mean, there's no point providing a great quality if no one can afford it. And there's no point driving down cost if it significantly impacts on quality. We've gone one step further in our definition of quality. So our definition of quality is not only defined by the healthcare team, but it's also equally defined by patients. And so every year, we're actually, all our patients are constantly surveyed, and once a year, the Ministry of Health does an external assessment, the patient experience survey, where we survey patients' experience in the inpatient, emergency department, hospital outpatient, primary care, and community hospitals. And this then gives rise to this 4-quadrant chart, where we want our institutions to actually be in this top right-hand quadrant, where quality is constantly, we're trying to push quality, and we're trying to maintain costs or even see whether we can lower overall costs. This is not the quadrant where we want to be, where quality is dropping and costs are rising. And you can see the other 2 quadrants. The original Academic Medical Center started this journey in 2016. And as you can see over the years, we've been able to drive quality and actually do this at a lower cost than we did before. We have since shared this methodology with our other sister institutions, and you can see the direction. And this has now been shared with the rest of Singapore. In terms of training current and future staff, we do this not only just for the hospital, but for the community. We have a very large simulation hospital where we constantly have our students and staff practice their skills in multidisciplinary teams. And this is complemented with their direct patient care. We equally have students working out in the community. This is a paper published in Academic Medicine several years ago, where we've documented the benefit of students actually working in the community in a longitudinal, interprofessional, student-run home visit program. And I think that this, this combination of driving education, of setting standards, and seeing how we can develop solutions has impacted our ability to handle COVID. These are the national COVID statistics as of last night. So Singapore has had 59,869 cases involved. But thankfully, the number of active cases currently is 109. The number of deaths has been thankfully very low at 29, directly attributable to COVID, with 15 patients with COVID who died of other causes. Again, we see our role as the largest medical school in Singapore. A substantial number of the Singaporean healthcare workforce are alumni of our medical school. And I think that, again, we hope to try and work with our colleagues across Singapore in defining and measuring what excellence is. Certainly when we had a brand new disease hitting Singapore, our faculty responded in many ways. So we developed a symptom checker where a substantial number of people have logged on. This is the link to check whether or not their symptoms could be due to COVID, and then what should they do if they have such symptoms. And so we've had, as I mentioned, several 100,000 of our population logging on to this. There was a concern that we would not have sufficient nasopharyngeal swabs to be able to do all the diagnostic tests because of the global demand. So we've actually developed our own swabs, which are comparable with commercial swabs, and we just have our paper published in JAMA, otolaryngology, and head and neck surgery. And so Singapore is now self-sufficient in swabs. Our colleagues also developed protective tents so that they could intubate and work in the oropharyngeal space safely. We've been working in developing diagnostics. We've developed one of our spin-off companies has developed a rapid antigen test, which is Health Sciences Authority of Singapore approved. And colleagues in A-STAR and Tan Tock Seng Hospital and colleagues at A-STAR and the Defense Science Organization have come up with the PCR kits, which Singapore has been using. We are now moving into rapid diagnostics with the same sensitivity and specificity as PCR. And so this is one of our spin-off companies. In terms of our colleagues at Duke NUS, along with A-STAR and GenScript, have developed the first kit which can measure neutralizing antibodies. And we've been working very heavily in developing therapeutics, both human monoclonal antibodies, as well as in development of vaccines with our colleagues in Duke NUS and Acturus. In terms of education, we've been running a very active webinar series, and many people from Indonesia have been logging on to this. We've been running this since April of last year, and every time we run a webinar, we've had more than 1,000 people from 73 countries across all the continents in the world logging on. And we've been very fortunate to have the leadership of WHO, led by the Director General, Editor-in-Chief of Lancet, the Nigerian Director of the Nigerian Center for Disease Control sharing their experience, the Director of the Wellcome Trust, and the Director of the London School of Hygiene and Tropical Medicine, among several other faculty sharing their experience. So this is the big role in terms of education. Our School of Public Health, in the first, when the epidemic first broke, when the pandemic first broke, released a daily science report of what was all the known knowledge. And again, these are our contributions across the healthcare domain, around developing the tools required to tackle the pandemic, as well as the education involved. And finally, Dr. Cantor mentioned that academic medical centers and academic health systems can have a major impact in terms of the economy. We are currently working with at least 179 companies and playing a major role in the contribution of health and biomedical sciences to Singapore's economy. So thank you very much for having me. And again, working with colleagues across AAHCI, across ASEAN and internationally is what we feel is the role of academic health systems. Thank you very much.
Thank you, Professor John Wong, for your delightful presentation on best practices from National University Health System in Singapore. Now we will move on to our second speaker, Professor Edward Hillhouse. Professor Edward Hillhouse is Emeritus Professor of Medicine at the University of Leeds in the UK and a consultant to the Association of Academic Health Centre International in Washington, DC. In addition, he was previously Professor of Medicine at Weill Cornell Medical College and at the University of Warwick, where he was instrumental in securing an undergraduate medical school. At the University of Leeds, Professor Ed served as Dean for International Development, Dean of Medicine, and Faculty Dean for Medicine and Health. Under his leadership, the faculty was established with several new interdisciplinary research institutes and an international focus that saw it become one of the first international members of the Association of Academic Health Centre International. He also led the establishment of the first national academic health system in the state of Qatar. He will be speaking on confronting challenges of establishing an academic health system, perspectives from an AIM consultant. Professor Edward Hillhouse, welcome, and please go ahead.
Thank you. Good morning, and I'm delighted to be part of this webinar. My brief is to give you some sense of the challenges that you will face going forward, and some insights from my own work, but also from our visits to various institutions around the world as part of the AIM program. Next slide, please. Right, so challenge one, organizational sustainability. Now, as you move forward, it's absolutely critical that the academic health system or center you put in place survives over a sustained period of time, particularly that it will survive any leadership change that will take place. And what we've noticed, or what I've noticed, is that the most important thing here is not necessarily the formal power that exists within the organization, but the informal power. That is the key people in the institution that are going to influence and lead the change for you. And this will be right across the organization, in nursing, in physiotherapy, in medicine, in science. These are the critical people that need to be brought into the organization and understand what is happening. You will need to confront mission divergence. There is no doubt that the mission of the university and the health and the clinical center will be different. And what will bring you together is the clarity of purpose and the fact that you're there for one purpose alone as an academic health system, and that is to improve the quality of life of the patients. A second slide, please. Then the biggest challenge you'll face is how do you get a robust and transparent financial model that will enable the system to be sustained. You will probably already appreciate the conflicting priorities, and that the clinical system can soak up as much money as you throw at it. And John Wong has clearly showed us that you can drive down those costs and improve quality as part of an academic health system. But also there's a great disparity between the clinical and academic funding. So how do you support the academic endeavor is really critical. So one of the things you will need to face early on is finding a way for funding a protected time for those clinicians that wish to undertake academic activities, both in research and education. Next slide, please. The third challenge is building capacity and capability. We found that some of our visits, organizations have found it difficult to identify early on what will differentiate them from their competitors. And this is really critical. What is it about your organization that will put you on the national map, but also the international map? And this is all about developing critical mass in key areas. In several institutions we visited as part of the AIM program, we've noted that there are large clinical programs which do not have any major academic underpinning, and therefore there's a lack of critical analysis about what is taking place within the clinical programs, and that's really critical. We've also noticed that partnerships which are simply there to have a brand attached to the academic health system are not really suitable, and that the most effective of partnerships are those that address gaps in your organization. That could be in clinical services and it could be in academic activity. And it is absolutely clear that you need to develop career pathways for young clinical academics. And this needs to be done at an early stage so that young clinicians are not disadvantaged if they undertake academic activities. Next slide, please. Then you need to find mechanisms for facilitating internal alignment, and Dr. John Wong has already shown us how Singapore has addressed these challenges. I've used in the past the institute model. These can be either virtual or real. And this brings together interdisciplinary teams under a single leadership within the institute. And this could be in cardiovascular sciences, it could be in infectious diseases, it could be in neurosciences, anything where you feel you have enough critical mass to bring people together. And then the institute will take responsibility for both the clinical programs as well as the academic activity within that specialty. Clinical trials is also a very good way of bringing people together and aligning them, because clinical trials is exactly where the clinical programs intersect with the research programs. And we've noticed in those institutions that are undertaking clinical trials that they have much more awareness of the integration of the systems. There is also very good evidence internationally coming out now that organizations that participate in clinical trials actually have improved clinical outcomes. Next slide, please. Then you have to work out how you're going to interact with the community. And again, Dr. Wong has shown us how Singapore has addressed this with the polyclinics. It's clear to me that improving primary care has to be a key role for the academic health system. It is also absolutely critical, both from a community point of view, but also from a government point of view, that public health and epidemiology play an important role in any developing academic health system. This will help to both inform what is going on in the community in those areas where you have underserved populations. And this is absolutely critical in delivering value to your community. Next slide, please. And then how do you embed into professional education? Well, the thing we've noticed is that it doesn't just happen. You have to have leadership, and you have to have a governance structure that allows you to put into professional education in place, and you have to put it up there on the agenda and on the agenda with the board. It is also clear that interprofessional practice comes first, and I noticed that when I visited Jakarta and Yogyakarta, there are excellent multidisciplinary teams, but it's clear that if you do not have multidisciplinary teams embedded across the organization, you can do as much interprofessional education as you like, but it will peter out when they get on the wards if their interprofessional teams are not already embedded. So I would urge you to work very closely in that integration. As students come through, they must be embedded into the clinical practice in interdisciplinary teams. Next challenge. Talent. It's all about people. And there's only three ways you can ensure you have enough talent, and that's recruitment, retention, and staff development. But the most important one here has to be the staff development programs. And this again requires leadership, it requires effort, and it needs to be focused at all levels of staff, but particularly at young people, and ensuring that they understand what an academic health system is, how it fits in across the community, how it benefits patients in the long term, and how it benefits the community. Staff development must be up there along with developing clinical career pathways for clinical academics. These are absolutely crucial first steps that you need to confront. Next slide, please. And then communication. Again, what we've noticed is that when we visited various organizations, that this requires real leadership, it requires a team, and you need to engage with staff at all levels. It's not just good enough for the leadership to know. Everybody throughout the organization must know what is happening and must understand what an academic health system is. So you need clear, simple messages. You need to engage your patients and the community. Again, they need to understand why money and effort is being put into research programs and educational programs, as well as clinical programs. And most importantly, you need to manage upwards as well as downwards. It's absolutely critical that you communicate what is going on with the government, and that you have a two-way dialogue with them, which I think you've already started, and you already have good lines of communication, but you need to keep those open. And a good way of doing that is celebrating success at all levels. Next slide, please. And finally, there's a real challenge in tracking progress. How do you know that you're on the right route and that you're achieving your goals? Well, first you need some sort of benchmarking, and we've already within your region, you have places like Singapore and Japan, and these are excellent for benchmarking yourselves at a very high level, but you also need to benchmark yourself with your national competitors and make sure that you're making progress against them. And for this, you'll need to develop key performance indicators. And this is actually really quite difficult for academic health systems. I would suggest that you use your traditional key performance indicators, but you look at non-traditional ones as well, because to see an impact on clinical outcomes may take a long time to see the impact of establishing the academic health system. But your non-traditional key performance indicators could be the number of people having interprofessional education, the number of patients enrolled into clinical trials, those sorts of things. But I would urge you to think very carefully about how you track progress within your academic health system. And I'd like to thank you for listening to me and hand you back to the moderator.
Thank you, Professor Edward Hillhouse. Such a wonderful presentation and perspective. I once again would like to remind all of the attendees to please use the Q&A feature at the bottom of your Zoom toolbar to insert your questions. And now let's move on the second panel sessions. And dear panelists, a friendly reminder that you will be given only 3 minutes to speak. First is from Universitas Indonesia, Professor Arif Fahrial Syam. Professor Arif Fahrial Syam is the Dean of Faculty of Medicine, Universitas Indonesia in 2017, leading a faculty which consists of more than 4,900 students. He was appointed as the coordinator of academic health systems, Universitas Indonesia, and also the regional ambassador for the Association of Academic Health Centers International, Southeast Asia Regional Office since 2018. Professor Ari, please go ahead.
Okay, thank you, Professor Ofi. So only 3 minutes. Yes, so thank you very much for the ladies and gentlemen. So yeah, we'll give brief information about academic health system in Indonesia. So it's our members and also our hospitals, and then working together with the Jakarta province. Okay, so the visions of academic health system, our vision is academic innovation through collaborative, outstanding healthcare for individual and communities. Actually, the first objective of this academic health system of Indonesia is integrate all resources in UI, health institutions, and partner of academic health system as to create a quality education process, research, and healthcare entirely. So mentioned from our previous rector. Okay, so if we see about the scheme of our academic health system, actually we start from what we call that the joint ministerial decree from Minister of Health and also Minister of Research and Technology and Higher Education at the time to in this decree to establish the academic health system in Indonesia. The core of this academic health center, Faculty of Medicine and Cipto Mangunkusumo Hospital, and now together with the teaching hospital of Indonesia, and we have the mainly Faculty of Medicine, and then working together with other faculty from health sciences. And then we have 7 teaching hospital joined in our academic health system, owned by Minister of Health, and also we have working together with the Jakarta province as well. And then time we give report to Minister of Health before, and also we discuss with the Governor of Jakarta. Okay, this is our network. You can see that together with other hospital, Jakarta, and then with the local public hospital, and then with the community health center, we working together to help. And this is the core of our academic health system, what we call the academic health center. Faculty of Medicine and Cipto Mangunkusumo. Educations about, we have education committee here, and also we have Indonesian Clinical Training and Education Center. For research, we have together Health Research Ethics Committee, and also together we have Center for Clinical Epidemiology and Evidence-Based Medicine. And for healthcare, some health center like Gastrointestinal Endoscopy Center and Stem Cell. For stem cell, we have, yes, this is the progress of our stem cell center. And then finally, on December, our Minister of Research to declare us as a national center for stem cell production and their metabolism. And also we have a clinical trial for stem cell for COVID as well. Okay, and other things that we working together with the faculty of to build the ventilator and also to make a flock swab and then some publications about that. And this is our program. Actually, before pandemic, our program with Jakarta province actually, but because about the pandemic, so we postpone these programs after pandemic. The main of this is mother and child health care, and then non-communicable disease, and elderly and geriatric care service, and COVID-19. Now we add COVID-19 to control and post-pandemic recovery. So we must prepare for this pandemic. Thank you very much. Thank you for your attention.
Thank you, Professor Ari. And then now is from Universitas Gadjah Mada. It will be Dr. May Neni Sitaresmi. Dr. May Neni Sitaresmi, PhD, is a consultant of pediatrician, is currently also the Vice Dean for Collaboration, Alumni and Community Service Faculty of Medicine, Universitas Gadjah Mada. She is the Vice Director of AAHCI, or Academic Health System of UGM. Dr. May Neni, the time is yours.
Okay, thank you very much, Prof. Ovi. Good morning, ladies and gentlemen. Firstly, we would like to thank the committee for this opportunity to share our experiences in implementing our academic health system. So this is our member, and the academic health system consists of 4 institutions. Okay. So the journey of our academic health system started on 2014 when our Faculty of Medicine UGM joined together with 5 teaching hospitals to initiate the development of academic health system UGM. And since then, some activities has been conducted such as benchmarking, workshop, and also advocacy to promote the concept of academic health system in the policy marker at national level. And on 2018, we was appointed by the Ministry of Higher Education as well as the Ministry of Health as one of 5 piloting academic health system in Indonesia. In the same year, the strategic plan of our academic health system was established, signed, and also declared by all academic health system member leaders. And it consists of 13 strategic outcomes and 14 key performance indicators. And in 2019, we have an opportunity to join the AIM program. And at the time, during 2.5 days, we have an open and also productive discussion with 3 consultants, including Professor Edward Hillhouse. And thank you, they give some recommendation to improve our organization alignment, to set and also to meet the strategic goal of the alignment. And last year, due to the COVID-19 pandemic, we refocused our program to COVID-19 while still attending to the issue of healthy aging and also maternal and child, which are often neglected due to the handling of the COVID pandemic. And in response to the pandemic, we established the task force for COVID-19 pandemic. And sorry, how can? Yeah. Okay, and in the field of education, we make some innovation and also adaptation in delivering learning material in order to fulfill the competence requirement of the student while still paying attention to their safety. In terms of collaboration and research, many research and innovation are carried out by our member in collaboration with another institution. For example, GENOS. GENOS is easy, simple, and also cheap tool to detect SARS-CoV-2 using an artificial intelligence. Recently it has been approved and also implemented in many public facilities. And also another innovation such as in a rapid test and also ventilator, in addition to approximately more than 60 research related to the COVID-19. And in health services, we know that at the beginning of the pandemic, we convert our microbiology laboratory to COVID-19 PCR laboratory, which didn't yet exist in our province at that time. And due to the pandemic, there is also such capacity in terms of facilities and also human resources. And to overcome this issue, we have mapped the search capacity and also the referral system for the COVID-19 management, including the establishment of field hospital as well as establishment of our two academic hospital, Dr. Sarjito Hospital and also Dr. Harjo Lukito Hospital as referral hospital for COVID-19 patient. And we also developed the manual for maternal and child health referral system during the pandemic 19. And we also do some activities in terms of to empower the community, such as the creation of pocketbook for village to battle the pandemic, and also we have some educational volunteer and also other social activities. And also some webinar capacity building also done at that time. Thank you very much for your attention. Good morning.
Very interesting presentation from Dr. Maineni. And now we will hear from Universitas Airlangga, Professor Budi Santoso. As an obstetrician and gynecologist, Prof. Budi Santoso is actively still practicing his clinical skills at Dr. Sutomo General Hospital, Kendang Sari Mother and Child Hospital, and also Al Shafi Clinic. His specialty is in the field of fertility and reproductive endocrinology, especially PCOS and endometriosis. Laparoscopy and hysteroscopy are his daily routines, which are done as form of hospital care in the field of infertility. He also pays a great attention to hospital management, since he also leads the management of several hospitals. Besides a lecturer and dean of Faculty of Medicine Universitas Airlangga, Prof. Budi Santoso is also actively conducting some research in the field of endocrinology. Professor Budi Santoso, please go ahead.
Okay. Thank you, Prof. Afi. Ladies and gentlemen, I would like to present the development of academic health system in Universitas Airlangga. And three focus area that I will present. The first is interprofessional education, the second is geriatric, and the third is disaster response and management. For the first focus, the interprofessional education, we have the three kinds. The community is community outreach program. In Indonesia is KKN, clinical in IPE in clinical setting, and the third education, community outreach program, and elective teaching. We have some of the module for the student and for the facilitator that the topic have about the HIV/AIDS, narcotic, psychotropic, and other addictive substance, outbreak, disaster management, and particular patient safety. For the community outreach program, in batch 61 in Lamongan district, include 13 students from 7 faculty. In batch 62 in Lamongan 2, July in 2020, 109 students for 11 faculties. So many other activities contribute the health, economic, and environmental education sector. Number of students involved in IPE program from the 2016, I will report just on the 2021 ongoing and by online learning. This is the IPE testing module in Universitas Airlangga with 5 topics. And the second focus about the geriatric. About the geriatric activation plan in 2021, the subject focus you can see on the screen, and this is the follow-up plan. So we have just do its geriatric action in 2020. For about the short focus, disaster response and management, about the COVID-19 pandemic and the other national disaster, earthquake and flood. On the collaboration between Airlangga University faculties and Universitas Airlangga Teaching Hospital have the three pillars of higher education. About education, IPE, interprofessional education, research, IPCR, interprofessional collaboration in research, IPSS, interprofessional collaboration in health services. So 15 faculties involved in this program. This is the daily report in our current activity in West Sulawesi about the disaster earthquake. The first is in Majene. After that, our floating hospital, this is use the PVC shape, traditional shape from the south of the Sulawesi. This hospital applicable to operation theater, one major OT and minor OT. So until 19 February 2020, outpatient, the total 514 patients, in surgery 60 patients, general surgery, ENT, ear, nose and throat, obstetric and gynecology, and orthopedic too. And the second place is in East Java, Jombang, disaster of flood. We had the activity to help some people that is living in Jombang with the several activity to help to increasing about healthy and others. So it is the last update about the natural disaster and pandemic response from our floating ship, and now until March 2021, our floating hospital stay in Mamuju. After from the Mamuju, I come back to Surabaya again. Thank you.
Thank you, Prof. Budi Santoso. And the next will be Professor Budu from Universitas Hasanuddin. Prof. Budu has serving as Dean of the Faculty since April 2018. Since 2019, Professor Budu has served as the Chairman of the Indonesian Medical Institution Association, covering 91 medical faculties throughout Indonesia. He is appointed as the coordinator for academic health system in Universitas Hasanuddin. Professor Budu, please, the time is yours.
Thank you very much. Good morning, everybody. Thank you for this opportunity for me to present academic health system of Hasanuddin University in Makassar. We very fortunate because Hasanuddin University Faculty of Medicine is located around many kinds of partner, especially in health boards. We are located together with main teaching hospital, and also around the public center of Seperti Makassar, and also around the other faculty in Hasanuddin University. So we very easy to coordinate each other. And this is the main, our location around just only maybe 1 kilometer around together. And this is our main teaching hospital with Vision Academic Health Center. And also we have once again Hasanuddin University Hospital as well. This hospital also develop academic health system in its vision. And Hasanuddin University Hospital in Wahidin our main teaching hospital located around many our satellite hospital in Makassar. So we built some program together to implement it program of academic health system in Makassar. This is first we have activated our program interprofessional education and also public health services together with our main teaching hospital and also together with the others health faculty like public health, dentistry, pharmacy, and also nurse faculty together to join like public health services together. This is we also have interprofessional education during COVID-19 in Hasan University hospital with online system together with our partner in the satellite hospital. This is a educational activity in our hospital together with other health professional clerkships members. This is activity of health services in our hospital together, just not only for medical, but also together with nurse, together with pharmacists, together with nurse, and also together with public health safety in hospital. We also have ethic commission of research belong of Faculty of Medicine, but some Faculty of Health also in hospital pointed this commission as one of center of commission of research in our faculty. This is a forum of ethical review committee in our faculty. We also have Hasanuddin University Medical Research Center located in Hasanuddin University Hospital. But this center can be used by others faculty, also by some our hospital, satellite of hospital to make some research, especially during the COVID-19 pandemic. Some of our samples is diagnostic in our medical research center in Hasanuddin University Hospital. This is patient safety training together, mock survey of academic medical center hospital accreditation standard. I would like to present to you academic health system during COVID-19 in Makassar. So together with the governor and our rector and medical research center together to build some procedure and some of the how to handle COVID-19. So from primary health care to Puskesmas to referral hospital, OTG is PDP, moderate, and very crisis and ventilator severe is not in our teaching hospital. So all of hospital in Makassar not service kinds of OTG and PD, but the ventilator like crisis and severe PDP and PDP is handled by our teaching hospital. We have like monitoring and evaluation of academic health system implementation in our hospital. Wahidin Hospital, for example, we just only make mark about this is the like program of our academic health system, okay or not, and okay or not. This is only just example. The format monitoring evaluation in interprofessional education. Then we make it continuously during the time, and then we make meeting continuously to make monitoring and evaluation of our academic health system. Thank you very much, Prof. Diana Sofia. Thank you.
Thank you. Thank you, Prof. Budu. I think that's a really great presentation. And now, last but not least, is from Universitas Pajajaran. Dr. Yudi Mulyana Hidayat is the President-elect of Indonesian Association for Obstetrics and Gynecology, head of the study program Oncology Gynecology Consultant, Obstetric and Gynecology Department, and also Chairman of Academic Health System and Dean of the Medical Faculty at Pajajaran University in Bandung, Indonesia. Dr. Yudi, please, the time is yours.
Thank you, Prof. Hopi. Sorry, my voice. Prof. Kadir from Ministry of Health, Prof. Aris from and Prof. Ari, Rector and Dean of Medical Faculty in University of Indonesia, CEO, Dr. Stephen, and all participants, good morning. Assalamualaikum warahmatullahi wabarakatuh. I think we'll share screen, probably, yeah? Sorry.
Yes, please. You can share your screen by yourself, Dr. Yudi.
Sorry. Sorry. Sorry.
Dr. Yudi, would you like for me to run your slides for you?
Yeah, okay.
Okay.
Yeah, because I already sent my presentation. Okay, thank you.
Is this the correct deck?
Yeah, okay. Okay, thank you. I'm from academic health system in Pajajaran University. As you know that West Java is number 2nd after Jakarta in population. We already had a letter of decree from our governor was separated 7 region and 7 regional hospital referral system. Yeah. This mapping from our governor, and then I have we improving of the concept of academic health system in Pajajaran University. As you know that the first improving of academic health center, because as you know that in our university we have 5 faculty in health family, and we made the strategic together to improving of academic health system, academic health center in Pajajaran University, and then to accelerate for healthy in the West Java. The West improving academic health system in the West Java, according of decree of our governor, for 7 referral hospital in the West Java, and then that's my facility. We made a primary clinic health services model in Pajajaran University. Will be disseminate in academic health system in the West Java. We have 2 clinic model, 3 clinic model, and 1 dentistry hospital, and 2 main hospital, Hasan Sadikin, and National Eye Hospital, to improving of our 7 regional hospital in the West Java. Of course, according Professor Wong from Singapore, I improving of primary health care facility first to make the referral system in AAHCI in West Java, and then secondary health system and tertiary separated by 7 referral hospital in West Java. And then to improving of 7 referral hospital, I send the facilitator team from for the improving of quality services, and of course many module from IPA and IPCC to implementation in primary health care in our area, West Java. And then for this academic system model in West Java, of course, the goal is policy holder certification and student certification. And of course, we can increasing of a community health degree, the goal of academic health system in West Java. But we have the first step, we improving about academic health system and academic health center in Pajajaran University. The first strategic planning. We made strategic planning for 5 faculty in our university and 2 teaching hospital, Hasan Sadikin Hospital and National Eye Hospital. And then we made of health training center to support 7 regional hospital in West Java. And then optimization of our clinic model, our clinic, primary and secondary clinic in Pajajaran University to disseminate, will be disseminated in the West Java primary healthcare system, and optimization of Pajajaran Dental Hospital. We made a healthy UNPAD program with BPS Goes to Campus and UNPAD Wellness Center. And then, of course, because this pandemic, we made a drive-through rapid test antigen with CEPAC and modules of disseminating of module of IPA and IPCC, and to support of research, we optimization of biomedic diagnostic center. And now I will ongoing, we improving about IT system. And in academic system in West Java, of course, the main responsibility for our governor in West Java, we must improving of 7 regional hospital and 1 ascending of Pandega Hospital in Pangandaran, and the second Pamengpek in Garut, to implementation IPE and IPCC academic system Pajajaran University. And of course, because all of the program, we have the problem with financial. Of course, we advocate to health insurance BPJS. And then opening of academic system and Pajajaran University and Hasan Sadikin hospitals, support to development of clinical guidance practice at hospital type B and C in our district, in our West Java area, and training clinical teachers of medical staff at 7 regional hospital, and training good clinical practice of medical staff at network hospital, and supervising of 4 primary health care as a piloting project in our district as academic clinical services model. Yeah, and then if this piloting will be disseminated in our in the West Java area, and strengthening vertical and horizontal referral and superficial education to clinical lecturer at network and regional hospital. Thank you, Prof. Ravi. Sorry, my voice, because I have problem with my voice. Good morning.
Thank you. Thank you, Dr. Yudi. Such impressive presentation already delivered by all of our panelists. Thank you for your time and support. And now I would like to read questions from our attendees. So sorry that we are already run out of time, and I will only ask one question to Professor Wong. Professor Wong, it is the first question today from Professor Ratna Sitompul. Professor Wong, you have been a provost in academic health system in UNS for many years. What is the benefit of having a provost or vice rector of AAHCI academic health system in the university? That's from Professor Ratna Sitompul. Please, Professor Wong.
Yes, thank you very much. That's an excellent question. I would say that there are three main benefits. Firstly, having someone coordinate the academic health system with the rest of the university allows a translational platform so that research from the university can actually be translated to benefit the community. Secondly, because of its very large service role, academic health systems are a great way to demonstrate the value of the university to the community. And then thirdly, having a provost for an academic health system allows the health system to coordinate and collaborate with all the disciplines in the university, because health and healthcare is more than just a medical science. It's also a social science, and you need to interact very closely with the social sciences, with the engineering sciences, and the technology sciences. Thank you.
Thank you, Professor Wong. I hope that it will also answer questions that already may be in mind of some of our here. But there is another question for, I think, for Professor Edward Hillhouse. It is from Dr. Ardi Vidyartini. Professor Edward Hillhouse, thank you for your inspiring presentations on the real implementation of a academic health system. Would you please elaborate on how you center strategize the staff recruitment, development, and career promotion? Thank you.
Right,
Thank you.
Our strategy when we did this, when we started out, was we identified that the three areas: recruitment, retention, and career development. We also wanted to link that in with our overall strategy. And our overall strategy was built around two things. One was to create centers of excellence. If you're going to develop a really meaningful academic health system that has impact, then you have to have those centers of excellence. But also we were very aware that we had areas of great clinical need. And I'll give an example from when I was doing this in Qatar. We had a big problem with neurosciences, and we had a big problem with stroke. And so we developed an academic, an institute, a multidisciplinary Institute of Neuroscience, and I recruited a leading neurologist from Canada, and he came and he recruited a number of other individuals, but at the same time, he started to, under the strategic plans, started to develop young people to work alongside him. He recruited a good neuroradiologist from overseas, and he started to develop these young people. And within 2 years, he published a very influential paper in the Lancet, showing the implementation of a rapid screening program for those patients with early onset symptoms of stroke. And we actually drove down the length of stay for our stroke patients dramatically. And at the same time, none of those patients were going through into the rehabilitation program. So this comes back to John Wong's point about how the instituting an academic program with careful recruitment and development of staff can actually improve quality at the same time as driving down costs. I think that's probably a great example.
Thank you, Professor Edward. This is a very, we have one question, but it could be answered by Professor Wong or Professor Edward. This is from Professor Ova Emilia, the Dean of the Universitas Gadjah Mada. I would like to ask to everyone, is there any requirements or condition that a university can develop academic health system? In Indonesian case, there are more than 90 universities. How many academic health systems would we establish? What should be considered? Do you think that academic health systems should be initiated by the government or by the university? So I think we want to hear it from you, Professor Wong, and also Professor Edward.
Well, okay, so let me start off in terms of Singapore. Yes, I think that, well, certainly in Singapore, being defined as an academic medical center, an academic health system, there are certain resources that come with it. But I think it starts off with, firstly, the culture of the organization. Does the university and the health system really want to work as partners? And if they, I think if the culture and the values are there, whereby both the healthcare system as well as the university system together put resources in for defined outcomes which are measurable and which the leadership of both sides work together to improve, I think that then, I think most systems would support and see how to promote the development of this sort of culture. Over.
Professor Edward, do you have something to add?
Hold on, I just need to unmute. Yes, all I would have to say is that I would agree with John. The two academic health systems I was involved with both started off actually within the university to start with. They then engaged, well, one of them started off in the university. That was when I was in Leeds, and the other one started off in the hospital when I was in Qatar. But they both came up from a recognized clinical need to improve patient care. And in both cases, the government became involved at a later stage. It can work either way, but it's better to be bottom up than top down, because top down doesn't always work. Bottom up doesn't always work as well. But if you get it right and get the government involved, then I think it's more sustainable.
Okay, so thank you so much. We know that we still have some questions, but we will answer the questions separately because we are already run out of time, and we will post them online with the recording as we do not have time today. So now we are reaching the end of our sessions. It has been such a delightful experience and discussion. Hopefully this meeting will bring new insight and perspective, particularly for the future of our academic health centers and academic health system in the region and beyond. Thank you for all for joining this session, and the recording and presentations will be available online soon. Thank you so much.
Thank you, the house, and
thank you all. We can have. Thank you, Professor Wong and Prof. Edward, Professor Ali, and all the deans. Thank you so much, and we will meet again in the next webinar. Thank you.
Thank you. Thank you. Morning.
Morning.
Terima kasih, Prof. Ari.
Terima kasih, Prof.
Prof. Ari, Pak Budi, Mas Budi.
Terima kasih.
Suara saya ini seri-serak.
Oh, langsung nih.